Hello and welcome to UroChannel. My name is Stefan Buntrock. I'm a urologist and sexologist. It's the asparagus season again. Time to recap the technical aspects of how to measure penile length and girth. I am going to reveal the pitfalls and give you tips and tricks how to do this for reliable results. My video about average penile length stirred a lot of interest among you and I received a lot of comments. Thank you for that. I noticed that there are a few repeating misconceptions about penile measurement, so I will point out what is important and put things in perspective. First of all, how do you measure? Erect or flaccid? Preferably both, also with the phenomenon of growers and showers in mind. But I think most of you are interested in the erect size. However, the erect size can be estimated by stretching the flaccid penis. This is done standing with the penis parallel to the floor at an angle of 90 degrees. If done correctly, the stretched length comes pretty close to the erect length, but it is necessary to apply a certain force. A minimum of 450 grams is required. That's roughly 16 ounces. It actually hurts a little, and in the literature, the greatest discrepancies between the results are observed when stretched penile length is reported. Number two is where to measure from. It is done on the upper side, which is called the dorsal side. Although there is some variability in how measurements were taken for scientific studies, the dorsal side is where all measure. Some use a rigid ruler. I prefer a measuring tape because due to the curvature of the penis, it might appear shorter with a rigid measuring device. Measurements are neither taken on the side of the penis nor underneath, and especially not from the anus, as some of you proposed. Body composition is a confounder because the more body fat, the smaller the penis appears because it gets buried in fat. Therefore, I prefer to measure from the pubic bone. In order to accomplish that, the measuring tape has to be pushed into the pubic fat, pushing the fat aside until the resistance of the pubic bone is felt. The reading is done at the tip of the penis. In studies, sometimes measurements are taken from skin to tip, where the penis enters the body, but in my opinion, this will result in unreliable readings because of the mentioned variations in individual body composition. Girth is the next thing to assess. Also here, researchers had different approaches. Most measure in the middle of the penile shaft or at the base. Many scientists agree that the coronal ridge at the tip of the penis is not a suitable spot for any measurements. Apart from all of that, there are a number of confounders that make it difficult to assess penile size. Especially in measurements of the flaccid penis, room temperature is important. The colder the room, the smaller the penis. Also, the exam situation itself may cause anxiety. That is accompanied by a surge of adrenaline, which makes the blood vessels contract, so the penis becomes smaller. Recent ejaculation may have an influence as well. For measuring erect length in the urological office, intracavernosal injection is used to bring about an erection. In this video, I outline how this is done. Okay, this is it. Have fun. Don't measure your penis at work, but at home. Don't forget to subscribe if you haven't done so. Hit your like and activate the bell. If you would like to watch more videos about the penis, check out this playlist. I will now go and prepare my dinner. See you next time. Bye bye.